Surrogate decision making is what happens when a patient lacks capacity to make decisions or to satisfy the conditions for informed consent. The patients are vulnerable. They're in need of a method to have their personal autonomy respected. A method which ensures that the decisions made do not harm them or benefit them. Non-maleficence, beneficence, it must be maintained in the process of this. How do we solve this issue? This is solved through a surrogate, whose job will be to make decisions in the patient's stead. And now, how do you find a surrogate? That should be a reliable surrogate. There's two primary principles to consider when you're choosing a surrogate. There's the authority principles and the guidance principles. The authority principle is basically when a person chosen to be a surrogate is basically the best person available who can represent the patient's value, their goals, their beliefs, and is in line with their thinking. It usually happens to be a family member or a friend or just someone indicated on an advance directive or a power of attorney. And according to there's a surrogate hierarchy, and according to the surrogate hierarchy, if you can't find any options from the family, I'm really sorry. Oof. If you can't find any options for the family, or there is no advance directive or power of attorney, you can look through the friends, of this person, and keep going down the list until you find a reliable person. Yeah. The guidance principles value respecting, a patient's autonomy and satisfying all other principles of consent. Advanced directives, like the ones I mentioned earlier, is an example of a guidance principle, which has three types, which is instructional advanced directives, which is basically a detailed instruction of the wants and needs of the patients medically. It's kind of like you're acting with the direct will of the patient and what they have indicated. There's also the proxy advanced directives, which is when they name a surrogate decision maker, kind of like to preserve their right to autonomy. This person will make decisions, that they most likely would make. A third of the advanced directive is basically a combination of both the instructional and advanced directives and the assigning of a surrogate. Some other examples of guidance principles are substituted judgment, which is basically when a chosen surrogate can make decisions in the patient's stead, as though they were in their shoes. And another is when the surrogate does what's in the best medical interest of the patient. When all other options they basically just have to make the best medical interest of the patient. This leads to a lot of potential problems. When you have advanced directives, you could have a scenario where a proxy surrogate doesn't really know about the patient's values and beliefs, which will lead to kind of make them making decisions not in line with what the patients will choose. People might technically be close, but they just don't know. They're not in the same line of thinking, and that can really affect things. And again, with advanced directives, there might be a situation where the information written is outdated. The person's belief might change throughout the years. You don't know when they did the advanced directives compared to when they're needed. So they would have to, they just didn't get a chance to update it as well. They also might have written it without the knowledge of advancement in technologies, new methods, new procedures. So this could affect a lot of things. With substituted judgment, there's a major problem in the authenticity of the information the person provides. It's not easy to be in someone's shoes, and it doesn't even meet the requirements of satisfying the patient's autonomy when it's a substituted judgment. It defeats the purpose. And for best interest principle, that's basically, it's you have a patient and a physician. They might have their own idea or opinion of what constitutes as the best interest. The doctor might be medically correct, but the patient might have a culture that prohibits these decisions. They can have their own idea of what they think is in the best interest, their own biases, and they're valid in it especially because of patient autonomy. So the doctor, obviously, it's more experience, has more studying going on, has more knowledge, so they're more likely going to have a lot of the correct information. But the patient still has a right to patient autonomy and knowing, they might have chosen something different as what would be the best interest to them. So, the best interest principles and substituted judgments, they're really not reliable in terms of patient autonomy. There's a lot of potential problems for, just misinformation, right, and just not satisfying the autonomy the patient would have liked, what they would have chosen. And that's not what we aim for when we're choosing a surrogate. Thank you.